Paddy started his career actually in the pharmaceutical industry and later moved to the natural health industry where he has worked for over 20 years. Paddy drove down from Auckland to be here. He is well known in the industry for his passion and commitment and believes in the power of natural remedies to age better health. This battle to regulate natural health products is not Paddy's first time in opposing this type of legislation. He fought it in 2007, he fought it in 2017, and he's here again to do it today. So could you please welcome Paddy to the stage?
Thank you, and thank you, Glenn, for those kind words. I probably don't need to speak. I think he said it all. First of all, thank you for turning out Wellington and turning on the weather. I hear that it's raining up north, so thank you. We're living in very interesting times, very troubling times actually, and it's very scary for some that legislation's been introduced by people that are put there in authority and seem to have an idea that they can put whatever that they want to put forward and it is for the benefit of everyone else. Well, this bill that's before Parliament at the moment has been put there by the Ministry of Health, and the Ministry of Health has asked the government to pass it in its current form, and we will fill in the details afterwards. Well, that's a recipe for disaster. That actually happened in Australia in 1989 when the government told the Australian natural health industry that they would have a light-handed approach with the TGA. And when it was introduced in 91, a lot of companies closed down because they couldn't meet the compliance costs. And a lot of the larger companies actually went offshore. So, not good. Okay, the Therapeutic Products Bill. Okay. So if you'll excuse me, I'll just see what I'm talking about. So what is, can you hear me? Yeah. So what is the Therapeutic Products Bill? It's actually a revamp of the 1981 Medicines Act. Okay, but it's a poorly written legislation, and it needs to be sent back to where it came from, and a little bit further. We were told, the natural health industry, by successive governments, that natural health products would not be included in any pharmaceutical type regime. Well, on the 11th hour, the government decides to include natural health products in a Therapeutic Products Bill. Now, a lot of people have been saying, oh, well, you know, it's good because natural health products, you'll be able to make therapeutic claims. Well, if anybody believes that, I've got a bridge for sale. There's no way the government is going to allow natural health products to make therapeutic claims. Under the 1981 Medicines Act at the moment, a therapeutic claim or a therapeutic purpose, you cannot claim to cure, treat or prevent any disease. Most of the labels that are on natural health products these days are basically health claims. You can't make a therapeutic claim. So do people seriously believe that including natural health products in a Therapeutic Products Bill alongside pharmaceutical medicines that they're going to make therapeutic claims? It's just not going to happen. It's just not going to happen. Okay, the submission process. Well, a lot of people have said to me that it's a lip service. Okay? We put in a submission and it was sent back because they didn't like some of the things that we said in there. It was the truth. You're not allowed to say the truth these days. It's very, very bad. So we sent it back. And nothing happened, so we contacted them to find out why we hadn't been requested to make an oral submission. A lot of people that made oral submissions have also said that when they were on the Zoom, that there was only 2 of the select committee there. It's disgusting. And this government looks like they're going to railroad this bill through Parliament. So we're doing our utmost to bring public awareness. The only article that I saw recently was on a Friday afternoon New Zealand Herald. I thought the article wasn't too badly written, and the person started off by saying that natural health products are regulated under the Dietary Supplement Regulations 1985, and then at the end of the article said that there's no regulation of dietary supplements. So, just can't make up their mind. Right, how am I going to... Okay. So, the Ministry of Health have actually convinced government that dietary supplements pose a greater risk to their health than food. Well, that's a fallacy. They've also said that it will increase exports. Now, of course, a government, as soon as they hear that a product is going to increase exports, obviously their ears pick up. Both of those statements are fallacies. There's no way that dietary supplements are dangerous. There's no recorded evidence anywhere in the world. Actually, they're safer than food. Did you know that over 600 people a year die from food poisoning in New Zealand? Okay. It's going to regulate a lot of small businesses out of existence with brands, well-known brands that most of you people know. Okay, so who are the winners? Or who are the spoilers? Not the Kiwis, because in this current legislation before Parliament, no one or anyone can import product from overseas, from iHerb or Amazon, with no restrictions whatsoever. Yet companies importing products from overseas are going to be penalised. It just doesn't make sense. So, obviously these companies need more money, okay, by the sound of it. And Australian manufacturers, of course, because the TGA in Australia has actually ring-fenced Australia. Okay, and as I said earlier, a lot of companies have actually gone offshore from Australia because of the compliance costs. Okay, I've just mentioned that, and experienced natural health practitioners are going to be squeezed out as well. Okay, that speaks for itself, but it's actually higher than that. That information is quite a few years old. I think it's probably up around about 65% of New Zealanders who want to take responsibility for their own health and well-being and don't need unelected bureaucrats telling them how to do it. Okay, so how safe is safe enough? Natural health products have an impeccable record. Impeccable. Okay, you don't see the hospitals filled up with people in the corridors. You know, someone was telling me yesterday, I was in New Plymouth, that they're having to cancel operations in the hospital in New Plymouth because they don't have enough hospital beds and there's people waiting in the corridors. That natural medicine's the safest way to avoid death. This is an actual report from the coroners in 2006. So just have a good read of that. Hope you're quick readers. And that's from the coroner's office. And yet the Ministry of Health tell Parliament that dietary supplements are safe and they need to be regulated under medicines. The Ministry of Health have wanted to harmonise with Australia since 1991. They've tried twice with the Australian Trans-Tasman Authority agency. And what they're trying to do now, this is a global push. This isn't just New Zealand. This isn't just Australia. It's Health Canada. It's the FDA in the US. Because these bureaucrats think that if you put something in a capsule, it's a medicine. Well, most trading partners do not regulate like Australia. In Australia, the products are called complementary medicines, which is a disgraceful term as far as I'm concerned. And the MedSafe and the Ministry of Health claim that they need to harmonise with the best practice of Australia. Well, it's complete fallacy. I'm talking to companies all the time in Australia, and they're basically saying that they're ring-fenced. It's a trade barrier. And there it says that garlic powder is considered a food, but once you put it into a capsule, they want to classify it as a medicine. You know, in Australia, a joint food, which is a powder, put it into a capsule, they want to classify it as a medicine. In Australia, most companies sell the same product. We call them Me Toos. Everyone's got a joint food, an omega-3 fish oil, and vitamin C. There's been no innovation in Australia for over 25 years since the TGA came into force. No innovation whatsoever. At least here in New Zealand, we've got innovative companies. And these companies are able to export to other countries because of the regulations that we have in place. Plus, these companies that have to or do export overseas have to meet the regulations of the countries that they're importing their product to. So they're going to get a double whammy. Regulation here, which is going to put a lot of companies out of business. The pharmacy industry and the medical industry are not happy with this Therapeutic Products Bill. So it's not just the natural health industry. In the European Union, the regulators decided that they were going to put natural health products under medicines. Even the DSHEA Act, or the Dietary Supplement Act in the USA, the FDA have been pushing for years. And the government, the American government, turned around and said, no, dietary supplements need to be under food. They've been under food in New Zealand since 1985. Why would they want to put them under medicines? The Ministry of Health employ over 100 staff to regulate pharmaceutical medicines. In Parliament, the Minister of Health was asked how many people this new agency, how much extra staff they would need. 150. Okay? Did you know that in Canberra, because I bring up Australia quite often, there's over 400 staff in Canberra administering the TGA, all paid for by industry. Not 1 cent comes from the government. Not 1 cent. The TGA went to John Howard when he was the Prime Minister in Australia asking for funding. And John Howard said, don't come to me, don't come to the government, get it from industry. It beggars belief that we're going to be faced with exorbitant costs which will put a lot of businesses out of business. Okay, this is a very interesting quote, and I thought it was quite prevalent for today's meeting because I mentioned earlier when we kicked off that there's been no recorded deaths from taking dietary supplements. And when you read that, you go, hang on a minute, what is going on here? You bring in regulation to protect public safety. Isn't that what regulation's all about? Public safety? Well, why introduce legislation when there's no risk whatsoever? It's all about building a bureaucracy, because MedSafe wants to be like the TGA. And has the TGA done anything for the health of Australians since 1991? No, they haven't.